so now we'll get into the actual conditions. Okay, so now we're on page 72. All right, so again, we talked about you have acute traumatic conditions. What kind of tissues are those going to affect? Inner tissues, so that's going to be what? Bones, ligaments. Okay. So you're either going to fall on your outstretched hand. So let's say you fall like this. What kind of forces are going into the elbow? Right, it's just shoving. Yeah, I mean it's shoving these two together. If you have a little bit of a bend like this, which one of these joints, which one of these bones do you think is going to be the one that's going to pop back? Or that's going to dislocate? Yeah. So what happens, I can't do that from here, but you'll see some pictures. Basically what happens is the ulnar pops out of joint and it goes back like that. Okay, and then we'll talk about the triangle alignment. Okay, you can see here, there's a triangle between the epicondyles and the olecranon. So there's a triangle like that. What happens is when the ulna comes out and back like that, because that little part right there slips back behind here, it drops down, so that triangle becomes a straight line. So that's one of the things we'll look at when we do inspection. If you look and you see that it's no longer a triangle, it's a straight line, it's not a good thing. But I would think chances are you're going to know already that when this big thing's sticking out back there like that, you're going to know it's dislocated already. Because we'll see if I have time, I'll play some videos that show elbow dislocations. Okay, so bones, you can have fractures. You can either land on the olecranon like this and fracture it straight this way, or if you do a Fuchs type of thing, you could fracture that, or you can fracture the radial head. So again, on the first one we talk about the olecranon is going to be direct contact. And then again, with these fractures and dislocations, you can have associated injuries with the ulnar nerve or the median nerve. Okay, again, just like any type of pre-traumatic injury or fracture, you can have swelling, tenderness to that area. If you tap on it, you're going to feel the pain. Or if you do things to tap, like let's say if you tap here, you're putting the force all the way through there, they might have pain in that area. Same kind of thing that we did with the ribs. You put pressure in one area, you feel it somewhere else, that's showing that there's some type of either tear to a ligament or maybe a bone stress fracture or traumatic fracture. Okay, so then if we get into, and then again, because there could be neurologic complications or vascular complications, you're going to check the distal nerve condition, if they have numbness, tingling, or loss of sensation, check their pulses, radial pulse, ulnar pulse. And then, like I say, for radial head, it could be a Fuchs injury. Again, there might be nerve trauma. And then this slide, actually, I don't think it's in the notes, but it just gives you kind of an overview of what we're going to be talking about, right? So you have acute trauma is going to affect the nerve tissue, bones, joints, ligaments, or bursa. Repetitive is going to be, as far as repetitive things that can affect the nerve tissues, you're going to have things like arthritis. And like I say, you could have a chronic irritation to the medial collateral from overuse, from pitching, things like that. But most of the repetitive ones are going to be into the contractile stuff. You have tendinitis, tendinosis, things like that. Then repetitive stuff, you can get neuro things, tonal entrapments. Okay, so we talked about that, olecranon fracture, radial head fracture. So with range of motion, they're not going to be wanting to move their elbow very much, right? If they dislocate it or they fracture it, they're going to come in, whatever position is most comfortable, they're going to be probably holding it like this. So here's different samples of fractures. In some cases, they're going to need pins and things to repair them. Okay, so now we're getting into the ligaments. So you have ulnar collateral ligament sprain. That's the most common one. You're not really going to see too much with the radial side. So it's usually going to be here. As far as repetitive types of things, it's going to be throwing injuries. So you can see when you're doing this, it's constantly pulling on that ulnar collateral ligament. So So if it's an acute sudden injury, they might hear a pop or snap, so they feel something there, and then they can have pain over that area. So it's logical. What would you expect? They would have some tenderness in that area. They might have some swelling. Okay. And then of course we already talked about the Doggins stress test for that. Stretching it with that. Okay, so then talking about joints, traumatic injuries, you have dislocation. So there's the thing like I was saying where the ulna slides back. Then you're going to lose that normal triangle alignment. And then you can have associated injuries can be, if it affects the blood vessels in the nerves, you can have the ischemia, or this Volkmann's contracture has to do with the loss of blood flow into the muscles. You're going to get type of contraction where the muscles are going to contract. Again, this is not really something that you're going to be dealing with. Most likely, if you're going to be treating somebody like this, they've already had the injury and they're saying, yeah, I get this chronic elbow pain because I broke my elbow, or I dislocated it, or something like that. Okay, so the most common dislocation of the elbow, like I said, is the ulnohumeral joint. The ulna gets pushed back. This is going to be something pretty easy to spot, right? You're going to say, I fell onto my hand like that, or skateboarding, or whatever. Okay, so then now we get into the bursitis, olecranon bursitis. It could be acute traumatic stuff, or it could be repetitive. You know, people that are doing things where they're putting pressure on their elbow a lot, like Myers' elbow, student's elbow. So you get contusion of the bursa with inflammation and swelling. And again, like I said, you can have different systemic conditions that can deposit into there, mostly gout. We've seen maybe sometimes people have a big lump right there and gouty arthritis. So there's an example of a swollen bursa. Pretty straightforward, right? All right, so then as far as other acute traumas, again, contractile tissues, usually the tendonitis is going to happen from repetitive trauma, but sometimes people will have a biceps tendon rupture. What happens is that tendon just ruptures, and then the biceps kind of rolls up, so you see a big bulge right here, and then you go look for the tendon, and it's not there anymore. And then neuro, like I said before, with different dislocations, fractures, you can have complications of the ulnar nerve and median nerve. And now as far as repetitive trauma, when you have bones and joints, you're going to have arthritic problems. You know, somebody can have repetitive injuries or just overuse, wear and tear. Usually osteoarthritis is going to affect more weight-bearing joints. It's usually going to be to the knees and the hips and things like that. But, you know, people have repetitive injuries, or let's say somebody was a jackhammer operator for 30 years, you know, they might have bone problems in their elbow. So again, with arthritic conditions, they're going to have pain either in the morning or pain in the evening. It's basically when the joint doesn't move, it gets stiff. Once you get it moving and it gets going, then the stiffness goes away. That's a common type of thing in any type of osteoarthritis. And then you can get, from overuse, you can get fibrosis of the ulnar collateral ligament like we talked about. And again, the bursa can be repetitive, direct pressure on that elbow. And then rheumatoid arthritis, gout, tuberculosis, different things can have deposits in that area. All right, so now we get into tennis elbow.